Welcome. This is the Compassion Fatigue Training Program for Advanced Practice Providers. This is the program introduction. I am Jessica. A little bit about me. My name is Jessica Parsons. I'm a family nurse practitioner. I've been a registered nurse for the past 10 years, and of that, a family nurse practitioner for the past 4 going on 5 years. My goals is to improve the practice for nursing and advanced practice providers. I'm currently enrolled at Wake Forest University School of Medicine's DNP program. I aimed to develop a program that would help APPs adjust to healthcare stressors and assist those who are suffering from compassion fatigue. A little bit about compassion fatigue. This can be defined as empathetic caregivers that are aware of a patient's needs but feel helpless and burdened to meet those needs. Compassion fatigue has been coined as the cost of caring. This can affect a provider's emotional, physical, social, and spiritual health, and this is typically impaired because of cumulative stress. Cumulative stressors affect the quality of patient care, and it can also affect the relationships that we have with others. A little background. Stress of a provider's role, which we all know can be a lot, it can translate into patient's care, where patients feel unsatisfied with the care that they receive. So, thinking about this, it can give you mixed opinions, but we know that we're all being judged. Not only are our patients getting surveyed, we're being judged for the quality of care which we provide, but also how satisfied the patient is from the care that they received. Also, untreated compassion fatigue can cause APPs to develop anxiety, depression, or even PTSD. Providers experiencing compassion fatigue may be perceived from patients and even family members, teammates as distant, unsympathetic, and unhappy. I use this picture on the right because most of us, when we enter a patient's room, we have the smiling picture there with our lab coat on, that we are there to listen and be present. If we look further into the image, that is what you get when you give a little bit of yourself to every single patient and you wish that you could give more. I created a program that consists of 3 modules. The first module is gratitude and positive thinking training. Module 2 is self care training, and then Module 3 is mindfulness training. Each modules are 30 days apiece, so the program altogether is 90 days. So each module consists of activities to complete weekly. The goal at minimum is to do 3 of 4 exercises. There will be 4 exercises that and activities that you can do each week. The intent of this is to learn new interventions that can help with stress, burnout, and well being. And there may be many of you that are not burned out or have a high level of stress. So, what this program will do for you is to help you remain resilient if adversity does occur. The the goal is to learn new things, new interventions, new activities that you can apply daily. This can help mitigate any compassion fatigue, and it can help you try to incorporate these daily. Our first module, thinking of positive thinking and gratitude. Positive thinking and gratitude training can help and have a positive impact on your overall health, not just professionally. The way we talk to ourselves has a profound impact on how we view ourselves and how others view us. Changing our internal dialogue is important for our personal growth. So, in this module, we'll learn numerous activities and exercises that will promote positive thinking and cultivate gratitude. Our second module on self care and compassion. Self compassion and self care is important, and they go hand in hand. And it is important for your not only your mental health but your physical health. It's a holistic approach. This can look different for each individual. So in this module, we'll learn things that take care of the physical, the emotional, social, and even spiritual aspects of self care. And then mindfulness training. In this is about being present in the moment, focusing on feelings, sensations without judgment or interpretation. Now, this module will have different training exercises on breath work, awareness of the mind and body, and even grounding activities. So, there is a survey that you will do a couple times through this program. And when I define couple, we'll say 4 times. It is known to be the most efficient method of assessing compassion fatigue. In its latest versions, it focused on three primary aspects of a professional well being, and that is burnout, compassion fatigue, and compassion satisfaction. While it's not intended to diagnose any issues, the scale provides valuable insight on a professional's overall quality of life. So, let me tell you how the surveys will be completed. Everything will be sent to an email. There is a survey that needs to complete before the program starts, after module 1, after module 2, and then at the end of the program after module 3. All surveys are de-identified and confidential. I've created a podcast called the Compassionate NP Podcast. It's on Spotify and is an innovative way to complete this training. If you don't want to follow along with these recorded PowerPoints, you can follow along on Spotify, where you can stop and start at your leisure and when you're able to make time to do the exercises. The episodes are less than 10 minutes. Primarily, most of them are less than 5 minutes. Here's a link directly here where you can listen to on Spotify, and you can even comment and send suggestions there as well. But this podcast does correspond directly with the exercises and is identified so that you know where you're at with the exercises. Journaling. We will do a complete module on journaling because it is very important and beneficial for anxiety, depression, stress, PTSD, trauma, and emotional well being. Not only does journaling help with those conditions and concerns, but it also helps you express your feelings, your thoughts, and your emotions. It also allows us a way to keep track of how you are doing in progressing through these modules, and also helps you kind of track to see if you're noticing any improvement in yourself. This is something that is personalized that you do on your own time. It might be something that you can continue doing outside of this program. First, I want to thank you. Thank you so much for initiating this program. Secondly, I hope it brings you joy. I hope it helps you progress towards a higher level of compassion satisfaction. And I want you to continue on with this program. Please continue to the introduction to journaling, and we will discuss more of how this is beneficial to your overall health as well as your progress through this program. And there's some references for you. Thank you so much. We'll see you in the introduction to journaling.